Hi there, welcome. I'm not going to tell you who I am, but this is the Philanthropic Planner Show. People who know me hopefully won't recognize me, but I'm Harry, and I'm a recent graduate of Hogwarts, and I majored in philanthropy. So I'm kind of a nerdy philanthropic witch. Now, if you buy any of that, you probably do know me. Welcome. We have two guests today. I'll forego all of the preliminary stuff that we usually talk about, why we put this program on, and philanthropic planning, a boring subject, but we want to share and have a meaningful dialogue in the community about the importance of philanthropy to the community. But our two guests today, you may recognize from previous Halloween programs that Boo the Friendly Ghost is back. And there's only one problem this year. Because of last year's fiasco, Boo is not talking this year. And we had a problem in getting Boo back, and Ellie has said that she will never do Boo again. So we are honored today, and we have a guest, Nancy Sheetz, who is the new executive director of Farmington Valley Visiting Nurse Association.
Thank you.
So welcome, Nancy.
Thank you for having me.
Welcome to your new job. Kind of exciting that. I mentioned to you on it, this is a very, very brave lady. I have to say that first, because I called her with very short notice and said that Nick Mason, don't blame me, blame Nick kind of thing, but I said we'd love to have you on. In the last 9 years, we had the former director, Nancy Muir, on once or twice, and I said, Nancy, we got to get you on. Maybe next week, next month, next year. And she volunteered today with 1 day notice. You are a brave lady.
Well, nothing ventured, nothing gained. I'm going to assume that you're a kind wizard and that it will work out fine for me.
I'm terrible, especially as a witch or a wizard.
Yeah.
Visiting nurse. Let me share with you a quick background.
Sure.
A week ago, and I mentioned to you before we got on air that Laura and I were in Indianapolis, and we get back, and the days are just full of appointments. And our first appointment last Monday was with a client, husband and wife, and they have a charitable remainder trust that is 20 years old. And one of the 4 remainder beneficiaries is the Farmington Valley Visiting Nurse Association. So the timing and the subject and the organization came to play there, okay? Right. I can't share with you the name or anonymously, but a significant gift when the two of them pass. And I would say over $50,000 would be 1/4 of the share. So it is significant. Right. And we have other clients and other people who have communicated over the years that Farmington Valley Visiting Nurse Association is very, very not just highly respected, but a great deal of gratitude in the services that have been provided. I find that the hospitals and volunteer ambulance and volunteer nursing association and so on. I know that it's over 100 years old, and I know that it's the largest and independent. So tell me why you took the challenge.
Well, I was fortunate. I have worked in healthcare for 34 years. Okay. I've always been, by trade or profession, I'm a nurse practitioner. And so part of my whole life has been in the healthcare field. While it was at a different practice than home care, I've just always serviced the public in the healthcare arena. I've been a resident of the town of Simsbury for 28 years.
Another 190, and
another 190.
You'll be considered a native.
There you go.
That's what I was told when I first moved.
Let's hope I don't live that long. I don't think it will be pretty. But I volunteered at different times in my life in the town in different ways, and I, based on where I was or how old my kids were. And recently, I thought, it's time for me to do something again. My kids are grown up; they're gone. I had a great job. I was working for one of the big hospitals in Hartford, and Long story short, a friend, a colleague said, the board of directors at the VNA is looking to expand. And so I was able to interview with them. I was able to be approved, and I joined the VNA in a different way. I went on their board of directors. I thought, well, this is local.
Wonderful.
This is a great way to serve my community.
Wonderful.
I hope I have some input for them because I'm from the world of psychiatry and behavioral health, but I am in healthcare enough. I understand the things that are happening today, and I love this little place that's in my community. I would get to know them. So I was on the board.
You're enjoying it?
I loved the agency. I fell in love once I joined the board because that got me to know who they were and all of the things that they do. Because I know what a visiting nurse association does, but I didn't know what the Farmington Valley did, and they do many more things than just visiting nursing.
All or parts of 11 communities?
Yeah, the Farmington Valley. We have over 11 towns that we reach out to. So Granby, North and West, East Granby, we have Simsbury, Canton, Avon, Farmington, Heartland. We'll go into West Hartford. Try to kind of reach out to the valley, and depending on where the patient might be, if it's right on the line, we certainly can look and see if we can add that to our mix. But when our executive director, decided that she was going to retire and try some different challenges, the board asked if I would consider stepping in, and I fell in love with the agency so much so that I thought this, and honestly for me it would be the first time that I could actually live here and serve my community. I've never really administered to my community much like I can in this job.
Well, I chose, and every program I start off kind of faking reading the Chronicle of Philanthropy, and this cover, The Aging of America. We have 10,000 baby boomers retiring every week, every day, I think, every day.
Right.
And we talk about care that's needed. In our small firm, we have a lot of clients that go through the stages of life, and whatever 5, 6, 7, 8 stages, and whether it's independent care, assisted care, or nursing home, or we find that a lot of people want to stay home and get services at home. So tell us about the home care that's provided by the visiting nurses.
Okay. Visiting nurses is mainly a sect of nursing that started so many years ago because nurses recognize that people are in their homes and have different healthcare needs. A long time ago, when the Farmington Valley started out, our first nurses were going to homes to help new mothers with infants in terms of how to teach them, how to make sure that they were taking care of their children correctly, how to assess whether or not a baby was doing well. What that's grown into, at least in the eyes of many, is primarily a service for the aging population. Time was in medicine. People died due to illnesses like infections because we didn't have medicines at the time. It was an illness, it caused certain symptoms, but antibiotics then became developed. And now people don't necessarily die from that sort of thing, but what the population is showing now, and it's going to get worse, is the fact that people are aging with 3 to 4 chronic illnesses: diabetes, heart disease, high blood pressure, high cholesterol, obesity, different things that are preventable to some extent, but cause a lot of deterioration. So you get people that are getting older, living longer with more illnesses. And a visiting nurse association really is there to kind of go out and service that sort of need. The things that have occurred as healthcare has changed and as the government has kind of shifted how it's going to help take care of, let's say, primarily a Medicare or Medicaid population, there's obviously more need in terms of healthcare than there is dollars. And the goal is to try to keep people out of the highest end care, like a hospital, and get them home, coupled with the fact that most people want to be home. Nobody in a hospital really wants to be there. So, you have people that could be fairly ill, still needing care, but in homes, and we
Does
go out.
insurance pay for some of these services?
They do if you meet certain criteria. So
Okay.
it's a challenge. But clearly, in order to qualify, let's say, for home care service, for something that we would give you, at least for the bulk of what we do, you have to be considered homebound.
Okay.
It doesn't mean you can't get out of your house. You could get to a doctor's appointment, but getting out of your house is difficult without assistance.
A real chore.
You know,
Yeah.
the acuity of what you're suffering from really needs to be tended to, but it's not like you're going out and about in your regular day. And your physician has to sign off and agree that right now, A, you need that care, and B, you really are somewhat glued to your home.
Now, if my insurance doesn't cover that, can I still use your services?
Well, if you're most insurances are always going to cover it. What we come across and how the Farmington Valley VNA is unique is that we have an amazing support from the towns that we service. So in addition to the direct dollars that we get from the paying sources like Medicare or private insurance,
Right.
we have support of all of our towns. They financially support us with a certain amount of funding every year. And what that does, it's really unique, I think. Farmington Valley is a very special part of the state of Connecticut,
Right.
in that we have a recognition of the fact that we want to have services in our towns that provide to the community that's really geared towards prevention and wellness. So if you don't happen to have insurance, or let's say you probably have insurance nowadays, but you may not meet the criteria for being considered homebound, but I know as your physician or your neighbor or somebody that you might need to have somebody come into your house medically, like the old days where a doc did a
Right.
visit,
Right.
we can do a home visit. We can do what's called a health supervision visit. We have the ability to utilize some of that town funding, and I could send a nurse to you to just kind of take a heads up and take a
periodically
look.
look and-
That's
and
right.
see
And
if
we
you're
might
okay.
come, educate you on something, bring a family member in, and say, okay, this is how you take this medication so that you don't get confused.
How does a person get referred, Nancy? Is it by family member? Is it by physician? Is it by someone else that refers? I sense that there's either a reluctance, a natural reluctance,
Right.
or not being aware of how to contact, or is it appropriate to contact?
Right.
So
Right.
someone that has that question, they should just call
They
you
just should call us.
and
They should
find
just
out.
call us, because there are a lot of ways that you can seek health care in any level. It could be a family member that calls us that says, hey, my mother lives in Simsbury. She just got out of the hospital. She didn't want them to set something up for her, but I know she's not doing well. Would you guys be able to go and see her? Most of our referrals probably come from hospitals because someone's been hospitalized and they know they're being discharged. They might come from nursing homes. They might be in assisted living that have utilized our services before.
Okay.
But it's always going to come around to us talking to your physician either having seen you recently, or you have to see them within so many days to also look at the patient to say, yeah, this person needs services, they qualify for home care,
For
and
maintenance
that's how.
of that
But we
care.
could initiate that process and move forward. So it doesn't always have to be from your physician
Yeah.
or from a medical center per se.
And we have a lot of, and recently it just seems like we're getting more of children living out of state. Somebody calls from
Yes.
California or Virginia or Ohio,
Right.
says my mother, who's a widow recently, and what kind of services that, and that's very important to know.
Right.
One, that you're here,
Right.
and the title of my program, and they always make fun of me in my titles, but here Boo and Harry are meeting Farmington Valley Nursing Association. That's it. But a jewel in the community, and I
Right.
really think that
Right.
the visiting nurse is a jewel. But there's this human nature part of it. I don't think I need care,
Right.
and then I go beyond that and think, yes, maybe I do need to care,
Right.
but I want to stay at home kind of
Right.
thing. Now, my mother passed this last year, and rather sudden, but she was at home, 93, and so on and so on, and ended up very quickly going from ICU to hospice.
Huh?
Now, you provide hospice care.
We do. There, one of the things that's a benefit to our agency, a lot of agencies do this, but we have what's called home care because we're taking care of somebody who's sick, who has an illness that's actively being treated because it can be stabilized or cured.
Right.
We also have two other kind of pockets of care. Palliative care is one, hospice care is another. And that's when you get to certain stages in life based on illness, not always age, but it tends to go with age, but based on what's the goal of the treatment. Palliative care is going to be care as opposed from aggressive treating, curing kind of medicine. Palliative care is going to be to kind of aid symptom relief. And it might be while you're treating an illness like cancer.
Yeah.
Palliative care is going to be how to manage your pain. I'm going to play around with things and give you something that's really just meant to relieve your discomfort.
Right.
Whereas you might get to a point in time where you decide that when you want to go on hospice care, the goal of hospice is not necessarily treating you, thinking we're going to cure your illness, but we are going to make you comfortable and not aggressively treat. Because the thing too that people just don't have an education on until sometimes you get into it.
Right.
Treatment itself, medicine itself, healthcare initiatives, they cause a burden on your system.
Very much so.
And, it's not always one that you decide. There might be a time where you decide that's not what my goals are anymore. Primarily because you've got an illness that if it really runs its course as expected, you'll pass away within 6 months.
Yeah.
Now, that's a hard thing to predict. It's not always accurate, but if that's sort of where you're at, then you might decide I'm just not going to be aggressive with the treatment that's meant to cure me as much as I want treatment that's going to make me comfortable.
And the spouse, let's assume that they're still together, very hard on the spouse in a lot of cases. So they need the assurance that professional help is there. They come periodically, they help with keep on track with meds and that kind of thing, because when you're alone, there's a tendency to forget my meds, or I don't want to eat. I don't want to eat.
Right.
Another thing we're seeing, and I guess it's the aging of America, is more dementia, or I don't know if there's more, Nancy, just me, or whether we just recognize it and identify it, and it's always been there, but now Alzheimer's and dementia and that kind of thing, it just seems like there's more of it.
Well, and you know what? It's not magic. It's not that all of a sudden it just kind of existed. It's always existed, but we have more ways we're trying to think we have more ways to treat it.
Yeah.
And we have more ways to maybe recognize it earlier or understand it or slow the progression of it. So, there are treatment options that, maybe before it gets to a certain point, you buy time by slowing it down or educating yourself about what you're going to need when you still have the capacity to make the decision.
Now, if I go to an independent facility, and these are so large today and more coming up and so on, and I go from independent to assisted, do visiting nurses come to my facility at an assisted care place?
We do, and a lot of agencies do.
Okay.
One of the things that I think we want to try to work better at is being a good resource for people at any age, my age, younger, and before you're 75 or 80, or even at that stage. But I think it's difficult to navigate the healthcare world when you're not in it. You only use it when you're sick.
Right.
So, what we can do is, if people were to call us, we could teach you about what is the difference between independent living, senior living. When do you go to assisted living? what is that? Where do you find that? And how is it necessary to kind of set yourself up to go to a place that also has skilled nursing and or now what it's called, which is a nicer way to say it, memory care units.
Okay.
They don't have Alzheimer's or dementia units anymore. They're called memory care.
Well, I need that.
That's all right. We
that.
have a special place for you. But, now the Farmington Valley VNA contracts with a number of these services in the valley, so that if they have a patient that's even in independent living,
partnering with them,
right? Some of them that have worked with us will recommend the VNA, and we go to that place, even if it's independent living, because they're now homebound because they broke a hip and they're back home again, or assisted living. We'll go there. We provide hospice services at many memory care units. Depending on the place, they also may have their own home care service.
See, I told you that we could talk for hours, right?
Yes, we could.
I've got a couple of things that I want to plug in here because Karen's going to flash up here and say you've got 10 seconds.
Oops. Oh, and poor Boo. Boo's done.
Volunteering.
Yes.
I want to talk about volunteering. I want to talk about employment opportunities.
Great.
I want to talk about my subject of how do we get you money?
That's
to me,
right.
and that's the reason we do this. In 9 years, we think we've raised over $8 million of expectancies, okay?
Wow.
And that's by will bequests
Right.
and by, gift annuities and cash. I can sign up and have a regular contribution to the visiting nurses and say, I want to give them $25 every month automatically. I can do that.
Right.
I can put that on my credit card or what have you.
Right.
I can, on an annual basis, just send a check. Website. I can get into your website, and it's a good website.
Thank you.
It's a good website, and it can walk me through how to contact and the services that they have that are very important. And curiosity-wise, even at my age of 94, I can get into the internet, and I don't come disguised. This Skype stuff, and they don't look at me, okay? And this thing is driving me nuts. And Karen, by the way, as we promote philanthropy and sending checks to visiting nurses, don't forget to send that little check to Simsbury Community TV, because Boo will be very happy next year. How big is the staff?
Oh, it's interesting. We are much bigger than people think. We have about 75 employees. We reach out in a number of places because part of what we do, aside from doing home care and hospice services, we've got social workers that also are part of our clinical spectrum. We have physical therapists, we have speech and language therapists, occupational therapists. We are school nurses in the town of Granby. We are community nurses here in Simsbury and throughout. We do blood pressure screenings every week. We do flu shot clinics and pneumonia shot clinics.
This is community health.
That's correct.
And
we do a lot of different things. So if you totaled all of us up, we're about 75.
Okay.
Yeah, it's a great organization.
It's impressive.
And we are very fortunate because we do have some donors that know us that have been dedicated to us for years. We probably need to do this a little bit better because we basically just send out an appeal letter once a year, and people are wonderfully generous. I wish we did a little more in terms of bequests and legacy giving, but we are very fortunate because there are some people that just come out of nowhere and they think about us when the time comes.
You are very good. You're very gracious. You represent visiting nurses very well. I, on the other hand, am a complete jerk. Graduating from Hogwarts or whatever in philanthropy, I'm a little tougher.
Yeah.
I think not only we would like to do more,
Right.
I like to throw the guilt trip and say, it's sad that we live in a community that's affluent. We talk about capacity, Nancy,
Right.
where we do have the capacity to give more,
Right.
and we don't.
Right.
And we can assess periodically and say, I have the capacity this year, I don't have the capacity. I can gift an old life insurance policy. my required minimum distribution from my IRA, because I'm over 70 and a half, I can gift $1,000 to visiting nurses and bypass me. I'm not taxed on it.
Right.
It goes directly from my IRA on my required minimum distribution. We have the capacity.
Yeah.
It's the demand of the services there.
Right.
But governmentally, it's cutting back. We're getting fewer funds from what we really count on.
Right.
And that's just the real world.
Right.
But you and I can do more. You and I, as philanthropists, can volunteer. That's the biggest part of philanthropy. But we also have the ability of periodically sitting down and maybe doing it direct. Get on the line, get in your bank, and send a check through your bank automatically. There are a lot of ways that we can gift to a jewel in the community, which is the Visiting Nurses Association.
Thank you. It's true.
Thank you for being so brave and coming with last notice and putting up with this craziness.
Well, I'm sorry I
This is
didn't wear my
driving me
costume.
nuts. And don't ask me where my wife got this. I have no idea. And Wicked, I have no idea where this came from. And yes, Charlie, I do need a haircut, so don't give me a bad time on that. Nancy, visiting nurse, 107, 118, or 8 years old. The services that are provided there. I hope, is there something that we can finish up on that we haven't talked about that's maybe on your radar?
Well, it's flu season. I hope people go out there and get their flu shots. You know, it's not always easy to ask for care. It's not always something that we want to address, but prevention goes a long way. And there are ways to avoid being hospitalized. So, and there are ways to just to get certain answers to all the questions that you might have. So please feel free to call us.
Just plan ahead.
Yeah,
Plan
ahead. And
we're living longer.
Yes,
And
we're
if
living
we
longer.
take care of
we
ourselves.
have illnesses. It's just the way we are. They're chronic.
Diet-wise, we can help with diet.
Right.
Okay.
Right. There's a lot of things we could do.
Thank you very much.
Thank you for having me.
You've been very good.
It was wonderful.
Boo, I'm going to retire you. I have no idea how to put you up there. Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.